So single payer is a healthcare model where there is one single entity that pays for all the healthcare that's provided. So one entity that collects all the money and then distributes it to all the people who are providing the services. So in essence, it's like having one giant insurance company. Medicare is similar to that. It's almost like a mini single-payer program within our country. The advantages of such a program are you don't have as much bureaucracy. You know, I as a provider, I am in favor of single-payer because I wouldn't have to contract with all these different insurance companies if I want to accept a patient's insurance. I wouldn't have to, you know, try to spend hours downloading different forms for each insurance company to try to get tests authorized or try to get paid for services which I've already provided. And as a patient, a single-payer system is great because you have your choice of provider.
There's only one thing, one kind of entity that adds no value at all to healthcare, and that's the insurance companies. They take, and their whole job, I mean, you saw it in Sicko, didn't you? It was really wonderful to hear people talking about it. Their whole job was to keep people from getting health care. They get bonuses for the people they turn down. Blue Cross, double cross. Blue Shield, no shield.
Now, what's the connection between economic inequities in this country and the health care plan that you're supporting?
Well, there's a direct connection between people being driven into poverty because they can't afford the cost of medical care. Half the bankruptcies in the country are directly connected to people not being able to pay their doctor bills. And of those, 75% are from people who previously had health insurance. So what we have is wealth accelerating to the top using the health insurance system as a mechanism to move that wealth upwards.
Recently at CPAC, the Conservative Political Action Conference in February of 2009, Mitt Romney won the presidential preference straw poll with 20% of the vote. So in essence, if they were choosing a nominee today, he'd be their guy. So let's take a look at Mitt Romney for this type of model. And I'm going to quote him from October 2007. He said, "The right way for us to go is to bring in the kind of market dynamics that make the economy so successful." I said that with the modicum of sarcasm, right? Now, of course, hindsight is 20/20, but isn't it true that so many on the conservative side are still putting healthcare reform out there in the form of a free market product? And what do you believe they can hope to achieve?
Well, we have had a free market system, and I'm afraid we're heading towards a model where we're going to have to be bailing out private insurance companies sometime soon too if we don't change things. We've had private insurance companies competing for contracts in Medicare and Medicaid, and they've not improved the quality of care, not improved outcomes for patients, and they've not kept costs down. I think we all know someone who has had a problem with accessing health care or with medical debt. And we need to let our legislators know that this is a problem that's reaching all Americans. And we also need to let them know that this is a problem that we need to address now if we are going to get out of the current economic crisis. Because health care costs, again, $1 in $5 in the United States is spent on health care. And I think the bottom line is we're a benevolent nation. We are a nation of a lot of resources, and we should be a nation that believes in healthcare as a basic human right for all Americans in our country. So I just hope that everyone takes this message back to their congressman, and maybe send Barack Obama a letter on his healthreform.gov page to let him know what we think and to keep single payer as an option in the discussions.